So I'd now like to welcome Mrs. Maria Gabriel, who is the European Commissioner for Digital Economy and Society, who's going to have a debate with Alexandre Regnault. They're going to be talking about the digital economy and how it supports or helps healthcare. Thank you, Guy. Hello, Commissioner. So the subject of our interview is the digital economy helping healthcare. Now, we think about data sharing, we think about tools, we think about artificial intelligence and algorithms. Now, my first question, because of course I have to talk to you about the Commission and what it's doing. The Commission on the 25th of April of this year, it talked about an initiative about doubling efforts to increase the availability of data and encouraging the sharing of healthcare data. What kind of data are we talking about? Who is going to benefit from this, and whereabouts are we after 5 months? Thank you very much. First of all, I'd like to thank you for the invitation. It's a great pleasure to be here. It's an honor to be with you today. Now, as far as electronic healthcare is concerned, I have to say that when I arrived at the Commission in July 2017, my first meeting at 9 o'clock in the morning was with the Healthcare Commissioner. So I arrived, I was young, I was dynamic, outgoing, and I thought that, well, we'd already heard about the strategy on the digital market and what it was doing for healthcare, and I thought we'd already moved ahead quite well. But in fact, when I went to the meeting, I realized that things were only just beginning, that we still had to agree to the next stages. So I have to say that at European level, it's not just necessary and important, it's urgent to accelerate cooperation. It's urgent to have healthcare as a primary and multidisciplinary focus. This means we have to change the way we work. The Commissioner is in charge of healthcare, but what about electronic healthcare? Well, that's under the responsibility of the Commissioner for the digital economy. So a publication has been brought out about our competences. The member states, of course, keep their own competences when it comes to healthcare, but the European Union is responsible for public healthcare, generally speaking. In this strategy, there are 3 pillars. The first pillar is access and protection of data. The second is strengthening our shared databases so that we can accelerate research and innovation. And the third, well, we have to talk about this more and more. What means can we make available to develop more and more applications? And here I'd like to draw your attention to mobile applications. There are so many of these. Europe needs people to develop these applications. Europe needs to raise awareness among citizens about these applications. So 5 months later, what have we done? Well, the first thing, just a few days after the meeting, was that we suggested that at European level, as part of the second pillar to reinforce cooperation, to draw up a common database on sequenced genomes. So we've got a European database that brings together 1 million sequenced genomes. Let me give you an example straight away. 17 member states have signed the declaration. So what about the UK? The UK signed, but not France. Yes, the first working group will be getting together on got together on the 21st of September. So if member states want their specific characteristics to be taken into account, they need to take part in this process right from the start. We've got the French program up to 2025, 200,000 genomes per year. But it's only by combining our strength that we will reach our objectives. And this reminds me of another figure. We put forward 3 declarations at European level on artificial intelligence, on the blockchain, and on healthcare. We've just got 17 countries that have signed, whereas it's over 20 for the first 2. So it's very important. Since the 25th of May, we've got the general regulation on the general protection of data. Yes, that was one of my questions. This regulation, we've heard a lot about it. It dates back to 2016. It came into force in May, and it's there to protect personal data. Now, how is it organized? Your initiative to share data, is that the data that we're talking about? Is it personal data or non-personal data that we're talking about? There are 2 things here. So the regulation, the European regulation, focuses on personal data, just personal data. Now, let me draw your attention to something else. The member states have to appoint the essential service operators because protecting personal data is not just the data itself, it's the infrastructure that is important. And hospitals are part of these critical infrastructures. So there have been attacks. 300,000 computers have been under attack already. I was in the unit that managed that crisis. On the first day, there were only 7 computers that were switched on that were able to react. 15 it was 15 on the Monday, but it's important in each member state, and this is planned in the NIS directive, which focuses on information security, to have one unit, one PC that's open 24 hours a day in order to be able to respond to such crises. So that's personal data. Now, for the first time, we're setting up the first right, the right to portability. We've got lots of obstacles. There might be interoperability between countries, access to files, but the format doesn't represent the specific characteristics of each country. So we need to do something about this to have the confidence of citizens and professionals. Less than 9% of hospitals give patients access to their files, and over half to personal data. It's because at the same time, there's another regulation, the iPrivacy regulation, that looks at the confidentiality of communication. So non-personal data there need to be protected. We're currently negotiating with the Council. We want to start the negotiations. The Parliament has already done a lot of good work. It has been doing work for months now. But there's a lot of hesitation because we've got all of this non-personal data, and Google, the gaffers, they can see our entire profile. What happens if this data is transferred to insurance companies? They can see that we have risky behavior. They know where we are. They can locate us. If you consult a Facebook page, just by chance, if you look at a medication, the next day you will receive lots of adverts linked to the company, the pharmaceutical company that makes the medication. So today our objective is between now and the end of the year to finalize all of this. But these 2 questions are covered by another question that we don't think about, and that is cybersecurity. We're not ready in Europe to offer cybersecurity, the necessary level of cybersecurity, even if we can work with the directors of hospitals, with healthcare professionals, even if we can ensure data portability. If we can't offer systems that secure them, we will not arrive at our objectives. And that's why, again, between now and the end of the year, we're going to finalize the negotiations. Personally, I'll be taking part in the work with the Parliament and the Council. What we want is to have an agency focusing on cybersecurity. ELISA. Has anybody even heard of the name of that agency? Usually when I ask the question in the room, 80% of people haven't heard of it. In fact, the agency already exists. It's been around for many years. For the first time, we want to give it operational capacities. When a member state asks ELISA to identify its vulnerabilities, the agency will provide the solutions. For the first time, we've got this European certification system. Today we buy a product, we don't know what the level of security that corresponds to that product is. So that's where it comes to industrial responsibility. So we want certifications to apply to all European countries. So 150,000 euros, the figures are quite high. And the last thing, for the first time, we need a European coordination mechanism. If there's a large-scale attack, it's up to European member states to do something about this. So we can understand the stakes when it comes to cybersecurity and the data and this double wish to allow for interoperability, but also to provide protection. So there's this specific points, sharing, databases, genome databases. So a call to France. France is not part of the 14 or 17 countries having signed the declaration dating back to April 2018. So there's a call that you are launching. We can pass that on to the Prime Minister this afternoon, perhaps. Let's talk about the tools now. And this makes me think of your introduction about the link between what's being done at European level and what's being done in the member states. In France, as you know probably, the government last week announced the deployment of a national healthcare strategy called My Health 2022 with a digital side in order to create a different digital services for healthcare professionals, but also a personalized digital space for patients. Now, what do you think about this kind of initiative on behalf of member states? It has been done in coordination with Europe. Perhaps you can talk about some initiatives that are comparable in other states. And what about the Commission? Does it encourage this kind of initiative? Of course, we can only encourage this kind of initiative. There is coordination at European level. And I've already mentioned some of these initiatives, the question of interoperability, increasing access, ensuring the protection of data. So we're very happy about these initiatives. What we're seeing is that we have these initiatives in other countries, but once again, we mustn't lose sight of different things in this field. We need to be focused on the citizen, on the protection of the citizen, and for this, on trust, and for this, it's very important to include right from the start when you're drawing up this kind of policy, because that's the challenge. We've got to involve directors, we've got to involve healthcare professionals right from the start, organizations involved in healthcare. We need to look at what's happening in the field. And we've got some examples of projects. During one of my visits to Greece, to Athens, in fact, there was a project that I saw financed by the European Commission. 80% of hospitals in Athens have a common database. They have electronic prescriptions, but the authorities explained that right from the start, the conditions of what was to be included and not, these were discussed collectively. So I think it's a great example of a collective initiative. And then in terms of financing, we're making sure that there are the right means. And can I draw your attention to the fact that there is a mechanism, very simple to use, it's not very well known, the Connecting Europe facility, the CEF. Many people think that it's linked too much to infrastructure, physical infrastructures, but in the case of Connecting European facilities, we are publishing calls so that people send in innovative projects through to the 12th of November. They have until the 12th of November. And this is a great initiative for France as well. There are different aspects that can be improved. Those promoting such projects can benefit from financing. So that's the call that's been launched. I'd like us to come back to artificial intelligence and what's being deployed very quickly in our countries. And let's talk about algorithms as well. A few days ago, the National Supervisory Committee published an opinion as part of the law, the bioethics law in France. The committee, in part of its opinion, expressly treated the deployment of digital technologies focusing on healthcare, and they looked at ethical issues. And if I've understood the concerns of the committee, the main concern, well, what they're suggesting in terms of algorithms is that any kind of processing mustn't take into account the specific characteristics of each patient, because that might undermine decisions taken in relation to the patient's treatment. So these concerns seem very legitimate, especially for patients who are not using digital technology, and 20% of patients are concerned by this. However, the Ethics Committee is still very cautious when it comes to the regulation. They're saying we mustn't block everything with the regulation. What do you think at European level? Does Europe intend to regulate the algorithms? And what about the software that provides support to these algorithms? Because the software are medical devices, software programs. There is a regulation entering into force in 2020, and we're not hearing anything about software. What can we think about that?
Well, two things. First of all, for artificial intelligence. Artificial intelligence is a huge opportunity. But artificial intelligence, today, we need to recognize that it frightens our citizens. It frightens them to a great degree. This is why in our European strategy, published in April, we focused on 3 points. Firstly, the reinforcement of our technological capacities. There are certain areas where we are world leaders. I'm thinking about robotics, for example. 25% of the robots produced in the world are made in Europe. And here we have the means to influence some of the examples that we've just heard. Secondly, the ethics question. Here, I think this is the added value of the European approach. it should be recognized. We should be courageous to say this. We're not the United States. We are not China. And what differentiates us is that we have values. Our approach to artificial intelligence is focused on humans, people in command. This is what is so important for me. So I can understand the arguments where people say, yes, you can't reveal all of the algorithms. These are business secrets, obviously. But now we know that it is the results of the algorithms that will influence people. Cambridge Analytica is an excellent example of this. So this is where people, human beings, should be at the beginning and the end of the process. So AI must be at the service of human beings. So for these ethical questions, we've set up two groups of people. One, a group of experts, high-level experts, who will be studying these issues, 52 experts. France has its representatives in this body. But in parallel, we've also formed a European alliance for artificial intelligence. The idea here is to say that our intention is not to regulate for the purpose of regulation. I want the Commission to really listen to what's happening in the field, to ensure that regulation is well targeted, is precise, and that regulation actually creates added value. This alliance brings together industry, operators, the banking system, and in 1 month we received over 1,350 applications to participate in the group. So this alliance is open. You can join at any moment as a simple citizen if you want. It's on the website, on the digital single market page of the European Commission. This alliance, and I will be seeing it in 10 days in Helsinki, is entrusted with proposing a guideline with recommendations on ethics, and together with them, we will examine in what area a regulation would be useful and in what other areas regulation would be useless, and it's possibly better to let the market remain free. Now, in terms of artificial intelligence, we also have to look at the impact on the labor market and on digital skills. Today, there's a real challenge, which is to invest more resources in training and improving people's digital skills. Today we have 80 million Europeans who've never used the internet. And we're talking about AI and quantum and blockchains. We have 44% of our European citizens, so 169 million, who don't have basic digital skills. So yes, in 2020, 90% of the jobs will require basic digital skills. And in the healthcare field, we cannot. And I would like to defend all of those who every day treat us and take care of us. And we can't ask them to do certain things. With the directives on cybersecurity and on algorithms, we still haven't even started training these people and making available training programs to them. And it is in this area that we really need to reinforce European support. On my side, what I'm in charge of in the next meeting, I propose the creation of a Digital Europe program. There are 5 areas in which no member state can intervene alone. One is AI, one is cybersecurity, the skills, these supercomputers, and also everything linked to digital innovations hubs. So 9 billion euros will be invested in this program. There'll be 2 billion for cybersecurity and 2 billion for artificial intelligence. To say that at the European level, we have to have the resources. First of all, we see that the cooperation among the member states is lagging behind. And that there are many decisions that need to be taken. So you need money in the next budget. Yes, in the next budget, because this commission is finishing its mandate finishing its term this October. And for the Horizon Europe program for research and innovation, we will also propose to increase the budget for these subjects. It's extremely important because I think we need to protect what we have that is unique in Europe and what robots and machines will never be able to replace. It's our creativity, our innovation, our social relationships need to be preserved. And healthcare professionals obviously are an excellent illustration of this. I think we all agree with this. I have just 1 minute to conclude. Guy surprised me in his introduction. We haven't understood the emergence of the digital economy. He called for Europe to really wake up. And do you believe that Europe can wake up? Yes, I do believe so, because digital is a real opportunity for us. Today, we have this strategy for the digital market. We have results with the protection of personal data, with the portability of content, with the end of roaming. But now we need to remain very mobilized. I continue to say to the member states, we don't have time to waste. We need to accelerate the process because China and the US are not waiting for us. They're investing huge amounts. They have no intention of respecting the standards and the values and the principles that we want to implement for our citizens. So it's time for the European Union, instead of losing time and copying what others are doing, it's time for us to focus on our own strategic capacities and to really play a role to regulate the digital economy in terms of values and in terms of an approach with man in charge, humans in charge. So long live Europe. Thank you very much.